Welcome to COVID Talks. Today I have with me Ms. Sara Roda. Ms. Roda is the Senior Policy Advisor at the Standing Committee of European Doctors, the CPME. She is a Portuguese lawyer and affiliated researcher at the Free University of Brussels. Her professional interest and focus is on digital health, especially data protection and health surveillance. Welcome, Ms. Roda.
It's very nice to be here, and thank you very much for this kind invitation.
Ms. Roda, today we would like to talk about the apps for COVID-19, especially the tracing apps. Could you please first tell me what types of apps are on the market, which are offered?
Yes, so we have apps with different functionalities, and one of the things that the European Data Protection Board has mentioned, we should not bundle all these functionalities together. So, for example, you have apps that provide information about the disease and credible one, apps that contain the functionality of symptom checker and self-diagnosis. You have apps for contact tracing. You have apps that issue warnings. You have apps that also give an information about the travels and do a mapping of the disease where they are. It's very creative, and further functionalities can always come forward.
Quite obviously, for the purpose of controlling the pandemic, the tracking is a very interesting point. So which mechanisms are there? How can apps be used to track persons in the scene of the COVID-19 pandemic?
The contact tracing has been done in the past, and it was in a manual form. Because of the disease and the expansion, this requires to be the digital contact tracing. And it can be based on the data location of the data subject. This was not seen as something that was privacy friendly, and in this regard, Singapore was one of the leading countries that were developing the Bluetooth low energy tracing, which is a technology that allows you to issue warnings, to issue signals to from one mobile to another without requiring the location data. So they record the encounters with this Bluetooth technology, which was seen as the most privacy-friendly mechanism. And this was imported and looked with good eyes by the European authorities. And so they are advising that for these contact tracing apps, we should not use location data or GPS data, but use the minimum information possible, and you can have the same results in principle with the Bluetooth technology.
So when I have such an app which checks on Bluetooth whether I'm close to another mobile phone which also has this app installed, there still has to be kind of a cross-check to a database where I can learn that one or the other phone, or actually the bearer of the phone, is a COVID-19 patient. So there has to be a check with a central database regularly. Is that correct?
Yes, and there you have some different approaches that countries are taking. So you have ones where that database is governed by competent authorities, and there is a central database. And you have the case for France and UK. They are defending this approach because they see this is the way that citizens can trust the app and therefore download it, because you need at least 60% of the population to download the app so that it makes it useful. But you have other countries that prefer a decentralized approach, meaning that the information that is on that database, it's only with codes in a pseudonymized form, and the matching of the person that is with your encounter with an infected person is done in the mobile phone of each person individually, meaning that you will not know the identity of the person. With a centralized app, you will also not know, because the competent authority will not tell you. But in the decentralized approach, the matching is done with your phone. But it's true, it's up to you to say that you are infected, and you give consent to the competent authorities to access the contact database, so the encounters that have been registered in your phone with the decentralized approach, you give authorization to give these contacts to the health authorities so that they can find out which and issue public alerts of these codes. And the other phones that have downloaded also the same app in a decentralized way, they can check the public codes of people that have been infected and if they match with the ones on their phone. And it will be the person that will know by themselves if they have been in contact with an infected person. So both have pros and cons in terms of privacy, but it's true, it really depends on the person for the decentralized approach, on the way they are dealing with the situation, if they cooperate or not. We need the cooperation of citizens for this to work.
So for the decentralized approach, we have to take or to make two assumptions. Number one is at least 60% have the app and use them, so it has to be on. And second, when they get a signal that they have been in contact with an infected person, they have to submit themselves to the system in order to get the protective effect.
Yes, and they also, their system, they have to download every day, so there would be downloads every day of codes of people informing that they have submitted to the COVID, and so the own telephone, the smartphone, sees these are the codes and see if they have matched with some, and then it will be then after. So you have A and B. A got infected, they issue the codes. B will download constantly the apps, and then it will be up to B on the role of possible infected person to again activate its contacts and so on.
Now, aside from the warning, you can also use the apps to track persons and to control whether they are staying in quarantine or in confinement, as the French say. Is that obviously works only if that is non-voluntary? Is that correct?
What the institutions are advocating is these apps should always be voluntary. There is one country where you have the option, either for in Poland, you have to accept in the beginning, either you see yourself at home and the self-quarantine is observed by law enforcement authorities, or you download the app where you have to do a picture of yourself, a selfie, with facial recognition to make sure that you are complying with the self-quarantine. For the other ones, we still have to see how it is the development, but in principle, the person should be in self-quarantine and there will be advice on what to proceed and how to proceed.
The app very often, especially in Europe, is discussed as the miracle tool to finally control COVID. Korea is a country, South Korea is a country that is very often mentioned for having a great success in controlling and containing COVID-19. They also mentioned that Korea has been using this app. Is that really the case, that the main success is coming through the app, or have there been other criteria which have been important for South Korea and their success?
Yes, that is a very good question. So South Korea is a combination of a lot of factors. One was the swift action of the government to do and take the necessary measures of self-confinement very early. Then you also had the widespread testing. They organized the possibility and created a lot of centers to help with the testing. You had the contact tracing app, and this is a very aggressive one in terms of privacy aspects. But you have the support from citizens, and so this would not be done if the citizens did not trust the government. Then they do. And in South Korea, they have issued legislation, emergency legislation, when there is this kind of pandemics, public health measures prevail over privacy. And this is accepted by the population and they have their support. So this is the combination of all factors that is why it's working.
But still in South Korea, the app is still, the use of the app is still voluntary.
It's voluntary for the South Koreans, but if you are traveling to South Korea, you must download the app. And also, if you are if you are labeled as an infected person, then you have to download the app so that you can be surveilled.
When such an app now is being developed, does it still have to go through a process of checking its applicability or its conformity with the European standards for data protection?
Yes. So The European Commission and also the European Data Protection Board, they are issuing several guidelines on how to build a good app. You have a recommendation from the Commission that was issued in early April. You have guidelines also from the Commission. You have the European Data Protection Board. So everyone is working, and also the European Data Protection Supervisor, on issuing how to build the good app. Then you have private consortiums that have taken the initiative to also work on this, because it's very technical, and you need to make sure that the technical part are being complied. And you will always need some independent supervision afterwards to make sure that what you have created is indeed in line with the specification and standards. So data protection authorities at national level will be the ones verifying the compliance of these apps, not only before, if they do data protection impact assessments, but after. But the community also, because these apps and the functionalities are being done some in open source. So to make sure that there is interoperability between the apps, they should all have the same, comply to the same standards, that they can talk with each other, those apps. So if you are in one country and want to move and go to another country, if you have this app open, it should also work with the app of the other country. Every country will have its own app, and to make sure there is this interoperability, countries are working together, and there are consortiums on how to build the technologies of the app. And we also have Apple and Google, who have bond and joined together to have a framework to install this interoperability framework in Android and iOS systems, in iPhone systems. So you would have to download first this interoperability from Apple and Google, and then you download the app of your country in order to be interoperable internationally.
COVID-19 is not the first pandemic we have seen, and probably will not be the last one. We have seasonal flu waves every year, which also have a very high death toll around the globe. Are there ideas to use such kind of tools not only for COVID-19 but also for other pandemics? Is there a discussion about that?
For the moment, it's mainly focused on COVID, and the purpose of these apps is for COVID only. And so this is also one of the characteristics, that once the pandemic is over, all the data should be deleted and there should be storage limitation on these apps. So you have the specific purpose of COVID. And other requirements and the possibility to foresee this use to other pandemics. It's something that it's, for example, the object of my research. I want to see what stays after, because governments can always say that there is a need to keep some of this technology for preventive measures to avoid that this another super spread. And until we have the vaccine, the need to have this app will, of course, be advocated and defended by member states as a substantial public interest, or just a public interest. But afterwards, you have the technology there. You have the knowledge to do so. You may easily use these apps for the future. That is something that we have to pay attention, how our rights will be after, and if they will not be used once these apps are out there.
As these apps are a little bit hyped now and seen as a, I said it before, kind of a miracle cure for containing COVID-19, is there a danger that they make people a little bit forgetting about the hygiene measures, the distance measures, the protective equipment which we use otherwise, like, for instance, face masks?
In this case, going back again for South Korea, the app is very present on the people way of living. So the app issues warnings when you are too close with someone. The app issues reminders to always wear the mask and to wash your hands. So they are always issuing messages. And people got the habit to always check what are the places where there is an infection or where there is someone infected passed by, and they don't go there anymore. So the population is very reactive to the message from the app and also from the government. It's only not the app, but the app is set to also help on those kind of reminders that the population will always need, because then there is, of course, afraid to loosen up once you are hearing the same thing for 2 months, and you are now slowly reopening, you try to open the economy, people might forget. So it's important that the message continue to be out of how to intensify your hygiene, keep distance, and so on. And also for employment purposes, because we see, for example, in Australia, they are not making it mandatory for people to use it, but they say, well, if you want to enter into this restaurant, you have to have downloaded in your mobile phone the app of the national app. If not, you have to give your contact details. Or they do, if you want to go to the football, you have to have this downloaded the app.
Personally, when there is an app available, are you going to download it?
I think I have to for research purposes. And yes, but maybe we should download it and then make sure that we delete it after the crisis ended. Maybe it's a civic duty to download the app to make sure that we comply with the situation. So yes.
Ms. Roda, thank you very much for taking the time and for giving me the interview.
Well, thank you.